Greetings, dear viewers. Welcome to Dr. Nguyen's YouTube channel, your trusted source of health and wellness information. Today we're tackling a topic that may be more familiar than you think, snoring. It's not just a nighttime nuisance, it's a widespread phenomenon that can have serious implications on our health. It's essential to understand this issue, its cause and effect, and how it can be managed. In the next few minutes, we will delve deeper into the comprehensive world of snoring, its causes, symptoms, diagnosis, treatment options, complications, and how to prevent it. Snoring is more than just a nighttime nuisance. It's a common condition that affects people of all ages. At its core, snoring is the sound of obstructed breathing during sleep. It happens when the relaxed tissues in your throat vibrate as air flows through them, resulting in the characteristic noise we all recognize. Snoring isn't simply an issue for the one producing the midnight symphony, but also for those within earshot, often disrupting their sleep. Yet it's not just about the noise. Snoring can be a sign of underlying health issues such as sleep apnea, a serious condition that requires medical attention. The mechanics behind snoring are complex, involving various factors such as your mouth anatomy, alcohol consumption, nasal problems, sleep deprivation, and even your sleep position. The good news is there are many ways to address it. Understanding the causes of snoring is the key to finding the right solutions. Snoring originates from a variety of factors that cause the narrowing of airways. These factors often disrupt the smooth passage of air, causing the surrounding tissues to vibrate and create that all too familiar sound. One major cause of snoring is obesity. Extra weight around the neck can squeeze the airway and prevent air from flowing freely. Another common culprit is alcohol. Its consumption can relax the throat muscles, narrowing the airway and increasing the vibration. Aging also plays a part. As we grow older, our throat becomes narrower and the muscle tone decreases, making snoring more likely. Anatomical abnormalities such as a deviated septum, enlarged tonsils, or a small lower jaw can also contribute to this issue. Each of these factors can restrict airflow and create the conditions for snoring to occur. But snoring isn't just a nighttime nuisance. It comes with a host of symptoms that can impact daily life. Daytime fatigue is a common sign, as the quality of sleep is often compromised. Morning headaches can also be a telltale sign, resulting from the decreased oxygen levels in the blood due to disrupted breathing. Frequent waking from sleep, whether remembered or not, is another symptom to watch out for. Remember, snoring isn't just about the noise. It's about the quality of your sleep, and ultimately the quality of your life. Recognizing these symptoms is the first step towards diagnosing the problem. Diagnosing snoring involves a thorough evaluation of your symptoms and medical history. This process is crucial as it paves the way for understanding the root cause of the problem. The diagnostic journey often begins with a detailed conversation with your healthcare provider. They may ask about your sleep habits, lifestyle factors, and any other symptoms you may be experiencing. The next step can involve a variety of tests. One of the most common is a sleep study, also known as a polysomnogram. This test records a variety of body functions during sleep, such as brain waves, heart rate, and breathing patterns. It's a comprehensive assessment that can provide a wealth of information about what's happening while you're catching those Z's. In some cases, imaging tests like X-rays or CT scans might be used to examine the structure of your airway for abnormalities. Remember, it's the role of healthcare professionals to determine the best methods for diagnosing your snoring. With accurate diagnosis, appropriate treatment can be determined. The treatment of snoring is as diverse as its causes. Indeed, there is no one-size-fits-all solution to this condition. To effectively manage snoring, we often need to consider a combination of treatments that cater to the individual's unique circumstances. Let's delve into the world of medical and non-medical interventions that could potentially turn your nights from a symphony of snores into a silent slumber. To begin with, lifestyle changes often serve as the first line of defense against snoring. Maintaining a healthy weight, reducing alcohol consumption, quitting smoking, and establishing a regular sleep schedule can all contribute to a reduction in snoring. Even something as simple as changing your sleep position, perhaps from lying on your back to your side, can make a world of difference. In some cases, over-the-counter devices may be beneficial. Nasal strips or dilators can help to keep the airways open, while oral appliances like mandibular advancement devices can help to keep the tongue from blocking the throat. It's always best to consult with a healthcare professional before starting any new treatments, even those that are available without a prescription. Medical treatments for snoring range from medications to surgeries. For example, continuous positive airway pressure, CPAP machines are often used to treat sleep apnea, a common cause of snoring. This device delivers a stream of air through a mask, keeping the airways open during sleep. Alternatively, surgeries such as uvulopalatopharyngoplasty, which removes or reshapes throat tissue, or the pillar procedure, which stiffens the soft palate, can also be effective. For those who prefer a non-invasive approach, therapies such as positional therapy or upper airway stimulation might be worth exploring. Positional therapy encourages sleepers to adopt positions that reduce snoring, while upper airway stimulation uses a small pulse generator to stimulate the muscles that keep the airways open. In conclusion, the world of snoring treatments is vast and varied. From simple lifestyle changes to high-tech therapies, there's a solution out there for everyone. Finding the right treatment requires understanding your unique situation and needs. So don't be afraid to explore, ask questions, and seek professional advice. After all, a good night's sleep is worth the effort. Untreated chronic snoring can lead to serious health complications. This statement is not to be taken lightly, folks. As harmless as snoring may seem, it can actually be a sign of more serious health issues. One of the most common complications of chronic snoring is sleep apnea, a disorder in which breathing repeatedly stops and starts during sleep. This can lead to daytime fatigue, morning headaches, and even memory issues. More alarmingly, sleep apnea can also increase your risk of developing heart conditions. The intermittent lack of oxygen during sleep can strain your cardiovascular system, leading to high blood pressure, heart disease, and even stroke. But it's not just about the physical toll. Snoring can also have a significant impact on your quality of life. It can lead to daytime sleepiness, decreased productivity, and may strain relationships. Imagine trying to sleep next to a freight train every night. It's not exactly conducive to a peaceful night's rest, is it? But there's good news. Snoring is not a life sentence. There are preventive measures you can take to reduce or even eliminate your snoring. First and foremost, maintaining a healthy lifestyle is key. Regular exercise and a balanced diet can help you lose weight, which in turn can reduce snoring. Alcohol and sedatives can relax the muscles in your throat and increase the likelihood of snoring, so it's best to avoid these, especially before bedtime. Second, consider your sleeping position. Sleeping on your back can cause your tongue to fall backwards into your throat, blocking the airway and leading to snoring. Simply sleeping on your side can make a world of difference. And finally, if you smoke, quit. Smoking irritates the membranes in the nose and throat, which can block the airways and cause snoring. These are just a few preventive measures. If you're concerned about your snoring, it's always best to consult with a healthcare professional. They can provide you with personalized advice and treatment options. Remember, prevention is always better than cure, especially when it comes to snoring. We've covered a lot of ground today, from understanding what snoring is to how to prevent it. We've taken a deep dive into its causes, symptoms, and diagnosis. We've explored various treatments, both medical and non-medical, and delved into potential complications. We've also discussed prevention strategies to help you take control of your sleep. Remember, your health is in your hands. If your snoring is affecting your sleep or quality of life, don't hesitate to seek help. Thank you for joining us today, and we look forward to seeing you in our next video.